Each year, millions of children die before the age of 5 in settings where there is no medical evaluation. If we are going to prevent these deaths, better information is needed on what is causing them. Most of these deaths are in Africa and South Asia. CHAMPS, Child Health and Mortality Prevention Surveillance, is working to generate data on the causes of death to improve policies and programs.
Mama, I'm up to lie, you know. I'm fed to fear so. I'm fed Mama and face a chair in the different. Carry and cham. Kadir and dear and dear uncle who pay me in the Isham and Tori Sway. Taki and cham. Near man, dear Amma Suta and Pang fed to Chuta fed.
Okay, so CHAMPS has a unique opportunity in Sierra Leone to address infant mortality and child mortality for that matter, because Sierra Leone continues to rank among some of the highest in terms of worldwide mortality across the board. In Sierra Leone, there is significantly proportion of the cases that are unknown in terms of what really cause of death for each child.
In Sierra Leone, CHAMPS teams work in communities to hear about stillbirths and deaths in children younger than 5 shortly after they occur. When families want to learn why their child died, CHAMPS teams take samples and conduct extensive testing.
So the lab testing is quite broad.
After reviewing records, measuring the child, and talking with the family about what happened, all of this information is reviewed by local experts to determine the causes of each death. Then, CHAMPS teams share the findings with families and works with communities to prevent further deaths.
We also do screening for HIV and the sickle cell testing. Once we get those results, these are communicated to communities to be able to mitigate actually further deaths.
CHAMPS uses advanced laboratory techniques and carefully examines tissues from the deceased child. The team looks for infections, signs of pregnancy complications, birth defects and malnutrition, and other conditions.
We give information that helps the living.
Ampanga noko kamak paransene no pit because chachochi menentione anoko ni to songi to chuka fet and cham amansong.
From our findings, we are looking at a number of areas, including reducing mortality from malaria, from malnutrition, from antimicrobial resistance. But we are seeing that majority of those issues actually have to do with systemic barriers to quality care in the health facility.
CHAMPS scientists share findings with many stakeholders, including government leaders who can improve policies and direct interventions.
So moving forward, really, like I said, the work is really eye-opening. We want CHAMPS to continue, obviously. We need to find out more what are killing the children.
So since the overall responsibility of the agency is for public health, and CHAMPS data that they are generating is of crucial importance for the effective running of the agency. We use that data for decision making, we use that data for policy, or use that data for intervention.
Well, CHAMPS, uncle Mungatongo, uncle Sounds Simptons, can I CHAMPS somewhere? A bugger maxum, and just I take the maxum, come in number one upon my so I say, take the maxum at open and CHAMPS, you know, the maxum.
We tell God thank you, and the CHAMPS, we God bring them calm na this country. Let God bless you now.